This is Lindsay. Lindsay was one of my students who ended up with a natural birth, a very short labor from what I've heard. And I heard you guys did wonderfully and that Bobby did great too. So I would love to hear your story.
Okay, well, it all started on March 30th at 6 o'clock in the morning. It was his actual due date, which shocked
That's
me.
surprising.
Yeah, I was very shocked. I was in bed. I was up from like 2 o'clock in the morning because I didn't sleep much these days anyways.
No.
And I was just kind of laying there, and at 6 o'clock, I'm like, oh, I don't feel right. So I got up, and my water broke, and it wasn't as much water as I was expecting. I was expecting like a gush of fluid, like I made it to the toilet, and it actually was, so I was kind of like, I don't know I know I didn't pee myself, but I wasn't sure if it was my actual water. So Bobby got online, and we Googled it, and he said, give it the sniff test. If it smells like bleach, it's good to go. So it was. And then I knew contractions would start shortly after that because I hadn't had any prior to that. So he's like, lay down and rest, because that's what we had talked about. So I got in bed, and that just wasn't happening. There was no resting. It was impossible. So I got up, and I used one of the techniques that I learned in the Bradley class. I sat backwards on the toilet, and that seemed to be the most comforting for me.
It's funny because people like laugh about it and get weird about that when we do that in practice, but really, like, a lot of people really like it.
Yeah, it worked out for me. And then he started timing contractions, and we had downloaded the app on the phone, but he was like so nervous he couldn't figure out the app, so he got a piece of paper and a pen, and he was trying to do it that way. So he got like maybe 6 down when he realized like they were really close together. So he's like, I don't know about
How far
this.
apart were they?
They were like 2 minutes apart the entire time.
Oh, wow.
There was no 20 minutes, 10 minutes, 5 minutes, 7 minutes. It was 2 minutes apart.
You just got
the entire
slammed
time.
right into it.
Yeah.
Wow.
So I started feeling like cramping, so I thought, all right, well, I was expecting the cramping, but I was kind of expecting my stomach to like tighten up more, and I wasn't really feeling that. It wasn't what I was expecting, that's all. It was really bad period cramps, and then, I don't know, it was kind of radiated from the front to the back. So I got in the shower, because it kind of was helped, or we were told it would help like ease the pain a little bit. It definitely helped. Leaned against the wall, did the whole shower thing, and I was in the shower, and he was starting to say, maybe we should think about going to the hospital. And I was like, I don't want to go yet. I don't want to get there too soon. I don't want to get sent home. I don't want them to tell me it's nothing, So we waited it out a little bit longer, and when I got out of the shower, I literally could not get dressed. I put my underwear on, had a contraction. Put my skirt on, had a contraction. Put my bra on, had a contraction. So I was like, okay, we can go now.
That's exactly what was happening to me when I was trying to get ready to go to the hospital. It took us like 45 minutes to get out of the house because like I would do one thing and then have a contraction and like
yeah, it was crazy. So we got in the car. He literally like pulled the car up on the angle. I mean, it was quick. Like we left. My bags were packed weeks in advance, so we were ready. So we loaded up. We got to the hospital, and I had a birth doula, Alex. And she was phenomenal. She met us at the hospital. She was going to come to the house, but there was no time for that.
Yeah.
So she met us at the hospital. She got there before I did, so that worked out well. She had the wheelchair waiting. Got in the wheelchair. Took me into labor and delivery. I think it was the emergency labor and delivery at Plantation General. And they were trying to get me to... They were asking me questions and trying to get me to sign paperwork, and it was impossible because I'm having contractions. And they were like, can you sign here? So it was contraction, sign, contraction, sign. So they put me in a room. And my doctor was actually on vacation still.
Yeah, I heard you ended up with the on-call doctor.
On-call doctor. So I wasn't really sure how that was going to go.
Yeah.
And when they asked me who my doctor was, they're like, okay, well, this doctor's on call. Okay. I had no choice, so we're going to make it work. So the labor and delivery nurse was actually amazing. She was like a 25-year-old girl. I mean, she was amazing.
That's awesome.
If it wasn't for her, I don't know if it would have worked out as well as it did. But she came in, she checked me, I was 5 centimeters, and we got to the hospital at 9 o'clock. So from 6 to 9, we stayed home. We left about 8:40-ish. And, yeah. And she checked me, so I was 5 centimeters, so when I told them I was doing this all natural, they were like, they laughed at me, literally.
Literally
they laughed? Yeah.
Wow.
They're like, yeah, okay, let us know when you're ready for the drugs, basically is what they told me.
Wow.
So they wanted to hook me up to the IV, and I asked about the hep lock, and they had no idea what I was talking about.
Seriously?
Seriously, had no idea what I was talking about. Yeah.
Anyway.
So my boyfriend Bobby, being a paramedic, he kind of explained that why does she need an IV? She's not dehydrated. She's been drinking water. She can eat ice chips. She doesn't need an IV. So they wanted to hook me up to the fetal monitor, and they did. That was one of the things that I was picking and choosing my battles going in because I knew. So I let them hook me up, and then Alex had asked if we could do like intermittent, and they weren't really. They said they wanted to do a half an hour off the at first.
That's a lot to start off with.
Yeah, and it definitely makes the contractions worse. So
yeah,
it really does. And so they did that, and when they got the monitor up and running, they were trying to tell us the baby's sugar was low, and Bobby's like, "Show me where." I mean, what's wrong, you know? So we actually let me go without the IV until I started pushing.
Why did they insist on it then?
I don't know. I'm not really
That's surprising.
sure. But I went without an IV for the entire time until I started pushing, and I have a brain fart.
How long were you pushing?
I pushed for about an hour and 20 minutes. But they let me go without the IV, and they actually left the room, which was better for us.
Yeah.
I was getting nervous. I'm like, can you please get a doctor in here? Because I felt like it was progressing so fast that I wanted to know something at that point, because they had left us in there for a couple hours. And the labor and delivery nurse was in and out, but she wasn't really giving much information. So finally they had the doctor come in, and he came in, and he had a straight face, and he goes, "Are you sure you want to do this?" And I knew in my head that if I said anything negative, it was not going to happen. So I said, "Yeah, I'm great." And he goes, "You're not great. I heard you screaming down the hallway." I said, "I wasn't screaming. I was moaning. And yes, I'm great. I'm doing this." And he's like, "All right." And he just had this straight, serious look on his face. Like, "Did you discuss this with Dr. Cohen?" I said, "Yeah, he knows all about it, you know." It actually, I think, worked out to my benefit that my doctor wasn't there, because this guy really didn't know me.
Yeah.
And he couldn't really push anything on me.
Right. So he was just kind of like, all right, well, if that's what you discussed, then let's do it.
So at one point, Bobby had walked out of the room, and one of the nurses in the labor and delivery area was like, "Why are you making her do this?" Like,
yes, because he forced you into it.
Because he forced me, right? But he explained that this was a decision that we both made. So anyways, the doctor comes in, and when he asked me if I was serious, he checked me, and I was like ready to go. He's like, "Oh, okay, so just let me know when you're ready to start pushing." And I was like, "Oh, okay." And I wasn't really ready, so I waited, and it was kind of hard to distinguish the contractions at that point.
They changed significantly.
And it was wild, because I definitely went through transitions. And Bobby and Alex were both wondering. They were like, "Is this it? Like, is she serious?" Because I was telling, no one else was in the room. So I was like, "I'm freaking out. I can't breathe. I don't know what to do. I can't do this anymore." But they knew to expect that.
Right.
So they were like, "No, you're doing great. You're doing awesome." And between the two of them, I think what helped me the most is when I was having contractions, they would push my hips together.
Yes.
And it made a world of difference. Like, I can't even imagine not having that.
It's funny because during practice, most moms find it really uncomfortable. Like, but then that's the thing. It's like during the practice, they don't like it, but during labor, they love it.
It made it that much more bearable. Like, so they were taking turns, because it gets tiring for one person. So if you have that second person, it's definitely a great help. So they were taking turns with that between contractions, and the contractions did get worse. But as soon as transition passed, I don't know exactly how long it was for me. I wasn't timing it.
Yeah.
But it wasn't more than 30 minutes. And I would probably say 15 to 20 minutes. And once it passed, it was just totally different. Everything changed. I was able to rest in between contractions, and I got to the point of pushing where I could actually feel the contractions coming, and I could tell the doctor, "Okay, get ready. I think it's coming." So, yeah, I pushed for an hour and 15 minutes. I didn't want an episiotomy, but that was another one of my battles that I was willing to lose in the hospital. So when he said that he didn't think that the tearing would be good, and that he thought he would have to cut me, I said, "Okay." I didn't argue with him. Go ahead, cut me.
And as long as it was something you were comfortable with, that's the important part. So,
So the baby was out in 10 minutes after that, and it was such a relief.
Yeah, absolutely.
They asked me if I wanted to see the head in the mirror, and I didn't really want to see it, so I was just like, I was fine with knowing that Bobby and Alex could see the baby's
Yes,
head.
yes.
I was fine with that. And they did awesome. I couldn't have done it without them. I couldn't have done it without the Bradley Method class, that's for sure. And without your help. And, I mean, once he came out, I mean, he was perfectly healthy. I mean, I didn't have any complications whatsoever, which...
That's awesome.
After you learn what you learn in Bradley Method classes, like...
all the things that could happen.
Yeah, exactly. I feel like it... Even Bobby said it was very textbook, like, from what we learned. Except for the whole contractions in the beginning part.
Yeah, it was interesting how they were really close together. And it's so different for every person. It's very different, so it's hard to know what it's going to be.
Because I was kind of expecting contractions to begin before my water broke.
Yeah, they usually do.
That's what I was expecting. And it didn't happen that way at all.
Any advice that you would have for other people trying to have a natural birth?
Even if you are going to do the Bradley Method and have the husband as your coach or the boyfriend as your coach, I would definitely recommend a doula as well, because it can be very overwhelming for one coach, I think. Especially, I mean, my doula, she's kind of up and coming. She's new at it, and she did awesome. She really did. And it helped him because they were able to take turns back and forth. They were able to encourage each other, encourage me, and they definitely stick up for you. Like if you, because you kind of lose your thought process about what's going on. You're just thinking, get this baby out of me, you know. And I remember everything though. I don't remember not remembering anything.
Yeah, and I didn't have anything that I didn't remember either. Like some people act like, you know, oh, you won't remember things, but I think it's you just don't have a sense of time, and in the moment you're not always able to communicate the way you would otherwise. Your brain's still working, you're still remembering all of it, you just can't communicate the same way.
It's very tiring, so definitely get rest beforehand. Don't wait till the last minute for that. Anything
you wish you had done beforehand? Anything that you wish you had done more or differently beforehand? Or did you feel like everything
definitely practice like what your plan is as far as positions and you know what's comfortable for you, because what works for me may not work for somebody else. But it's definitely good to know what works for you. I think that overall it was an amazing experience. I wouldn't have had it any other way. I would do it again in a heartbeat. The pain is not that bad. I mean, it is while you're going through it, but you get over it real fast and you forget about it. I mean, it was so worth it just to hear him cry when he came out, you know, and it was just like, yes, I did this, you know. And the doctor even said,
you can do anything now.
Yeah.
You've done this, you can do anything.
The doctor even said, he's like, I honestly don't think he had ever seen it before. He was like, you are 1% of people that actually go through with this.
Unmedicated 1%. Is 1%.
Yeah. And he's like, you were awesome. And he's like, I'm so happy for you. And I didn't have drugs afterwards they did stitch me, but I didn't have ibuprofen, Motrin, whatever they offer you. I didn't take anything. They gave me a little spray to kind of numb it a little bit, and that's what I used. And I was actually impressed, too, because they delivered the placenta pretty naturally.
Good.
They didn't pull on it or anything. And
good. Yeah, I mean, with breastfeeding, it usually kind of plops right out, and you don't even notice otherwise.
They had a student in the room, too, so it was kind of a procedure afterwards, because the doctor was, like, teaching him how to do the episiotomy and stuff like that. But, I don't know, I think I gave them a run for their money.
Sounds like it.
They were pretty impressed. So.
Anything else you want to share?
I think that's it. My little man's happy and healthy, and he loves to eat.
All right. Well, thank you so much.
You're welcome.